One of the first things that you mentioned in terms of the pluses was magnesium. Do you want to give a bit of a background on the research behind magnesium for ADHD? I do remember you mentioned, the vast majority of people who have attentional issues have a deficit in magnesium. So do you mind going a bit into that?
Sure. Yeah, I mean, I think it's one of the few things, and that's why it's one of the first chapters in the book, because I think it's the most important. And there's some research. A lot of there's not as much research as we would like in terms of nutritional interventions in mental health. But in our practice, looking at magnesium levels in blood and hair, I have found it over 90% of individuals with ADHD are deficient in magnesium. So it is critically important that people supplement it soon, early, and it's one of the few supplements we recommend without any testing. It's simple, it's safe, and it can really help with anxiety, sleep, as well as hyperactivity.
And what is magnesium for people who might not be aware of that?
Sure, magnesium is a mineral, meaning we obtain it from our diet. We can't make it, so we can't live without it. And it's at least in the States, we were getting like 400 to 500 milligrams, 75 years ago from our diet. And now with processed foods, we're getting half of that. So many people aren't getting the magnesium that they need. And there are hundreds of enzymes in the body, meaning for the body to work efficiently, for the brain to function, for our stress response to function, it needs adequate magnesium. And some of the first symptoms are common, things like constipation, insomnia, anxiety, irritability. So magnesium is probably the most common nutritional deficiency that I see in a nutritional psychiatry practice.
So it's much, much wider than just ADHD.
Absolutely, yes. And I think for people new to nutritional psychiatry, if they had one thing to learn, to read about, I would recommend magnesium because there's plenty of good information out there and it's that important.
When it comes to supplementation, does any magnesium off the shelf, confer the same benefits for adults and children alike?
Absolutely. Magnesium is inexpensive and there are many different forms. Most of us know magnesium as a laxative, right? Milk of magnesia. So at very high doses, magnesium oxide is the form. It works as a laxative, but with different forms. So I recommend if someone's supplementing for ADHD, they don't take magnesium oxide. They look at other forms of magnesium, and it's very simple to take unless somebody has kidney disease. It's very simple and safe, and people can notice a difference sometimes in 2 to 4 weeks.
Hmm. And it seems that there are, I think, at least 4 or 5 different types of magnesiums. Yeah, have I got that one right?
Yeah, there's magnesium glycinate, citrate, sulfate, threonate, different carriers. The only thing I think be important for your listeners to remember is try to avoid oxide because that is the laxative. Most of it's not absorbed.
Hmm.
Much of it, although there are doctors for people that can't afford supplements that recommend taking just a small amount of milk and magnesia. You'll get a little magnesium.
All right. You mentioned 75 years back, we were getting the adequate dose of upwards of 400 milligrams. Have I got that one right?
Yes, I mean because we didn't process grains, we were eating whole foods, and a lot of magnesium is in our green vegetables. Our chlorophyll molecule is magnesium is the center of everything that's green in the
Mhm.
plant world. It's in the husks of grains, so it's a important component of food. The problem is that we in the farms we never replaced magnesium. When we put fertilizer back in the soil, we keep depleting magnesium from our vegetables and the soil, but we don't put it back in.
Oh,
So
wow.
there's a depletion of magnesium in our soil as well.